Crimean War that happened in the 1800s. So during this war, the British army was sent to fight the war. And during that time, it was seen that the British army personnel used to suffer from a febrile illness, which was not seen in the other people who were previously living in those areas. Now, just to get the idea, this is the area of the near the Black Sea of the Crimea, and if we look at the geography over the Mediterranean Sea, there are two particular areas, Malta and Gibraltar. Now, why I am showing you all these things? Because this kind of illness was previously named after geographically. And during this time, Sir David Bruce was serving in the Royal Army and he was sent down there as a physician. And what he observed was the fever and he called it as a Mediterranean fever. Many people also named the fever as a Malta fever or the Rock of Gibraltar fever or rock fever, named after both Malta and Gibraltar. What was unusual about this fever was that this fever, what he described as febris undulans, this was directly in or much different from the fevers that was previously known like malaria, which was described as febris intermittens. That means if we look at the pattern of fever in malaria, it is intermittent fever with episodes of febrile episodes. Whereas in typhus or typhoid like illness, we have what is called as a continuous fever. But this fever did not either have a continuous fever or an intermittent fever. The fever would come, go out, again come, and hence it was called as undulating fever. Later on, David Bruce and his wife both were able to isolate the organism which caused this fever, and they called it as Micrococcus melitensis. Another interesting finding was that all the people who were living in this area, they were pretty much resistant to the disease. Only the people who actually came to the area were suffering from the disease. Later on, the Danish workers found out a particular disease called as Banks disease was seen in the cattle population. Further research was done and it was established that the causative organism in both the cattle and human beings were the same, and hence this organism was named after David Bruce as Brucella melitensis. Okay. Now, historically speaking, this fever was originally called as a Mediterranean fever because it was observed in the Mediterranean region. But why we are talking about this? Because this fever is not only restricted to this area. Even in India, this disease is very common. So, let us learn about the organism. This organism is a gram-negative coccobacilli. Furthermore, they have been classified into the four main categories, that is Brucella melitensis, Brucella abortus, Brucella suis and Brucella canis. Now, if you look over here, these are all named according to the animal they usually infect. Now, look at this chart. Brucella melitensis, it predominantly affects sheep, camels and goats. Abortus predominantly affects cows, camels, buffalo or the cattle population. Suis, as the name suggests, it affects the pigs, and canis, as the name suggests, it affects the dogs. Now, why this is important? Because Brucella in India is a very important zoonotic disease. Zoonotic disease means the disease which can be transmitted from animals to human beings. Now, how does this disease spread? There are many routes. Predominant route would be either through aerosol route, in which the organisms are inhaled, or through ingestion. Now, if we look at the pathogenesis, after a person is exposed to this organism, either through ingestion or through aerosol, the organism first enters either into the GI system, that is the stomach and the intestine, or the respiratory system. Now, this organism initially does not show a very high inflammatory reaction, and it escapes the body's immune system and enters into the reticuloendothelial system, especially the bone marrow, liver, etc. Now, one of the one of the important features of this organism is, now remember this Brucella is a intracellular organism. And if you do recall about how our immune system tackles the intracellular organisms, is predominantly through the cell mediated and the humoral immunity. Now this organism is very capable to reduce the effect of TNF-alpha. Now what does this TNF-alpha actually helps in? It induces the natural killer cells, thereby killing all the human cells which have this organism. Thereby, this organism persists within the reticuloendothelial cells for a prolonged period of time. Although significant production of antibodies is seen. Now, what will be the manifestations? Obviously, because it causes bacteremia, fever will be associated. Fever can have a spikes with rigors, then it will heal, again come back with an undulating pattern. Another important pathognomic feature that is usually seen in brucellosis is malodorous perspiration. That means after the spike of the fever, when the patient starts sweating, we can find that there is a bad odor in the sweat. Furthermore, we can find other constitutional symptoms which are non-specific like lymphadenopathy, hepatomegaly, splenomegaly, etc. Now, if we do enlist all the symptoms, it would include respiratory symptoms like cough, headache, fever, lymphadenopathy, night sweats, hepatosplenomegaly, weight loss, myalgia, etc. Now, if we look at all these symptoms, there is one more disease which we commonly encounter in our population, which shows these kind of symptoms. That is fever, especially with the evening rise, weight loss, constitutional symptoms, and it really mimics tuberculosis. So, always in any patient who has this kind of manifestation, keep brucellosis in your differential diagnosis. The brucellosis can also be categorized whether it's acute, subacute or chronic. However, the classification is pretty much subjective. Most of the time, the patient will present with chronic manifestations. Among the important chronic manifestations would be osteoarticular manifestation. Predominantly, we can find peripheral arthritis, especially of the knees and the hip joints, or we can find inflammation in the vertebral column manifesting with sacroiliitis or spondylitis. An important sign in this is a Pons sign, where you can find that between the two vertebrae there is a bulging of the intervertebral space. Furthermore, it can also affect other symptoms like in males, epididymic orchitis is seen. In females, especially in pregnant women, spontaneous abortion can occur, not only in cattle but also in human beings. Other systemic inflammation may include inflammation of the liver, that is the hepatitis, and central nervous system infections including meningitis, encephalitis or meningoencephalitis. Sometimes rashes on the skin may also be observed, and infections of the cardiovascular system would include endocarditis, which is a very important cause of mortality in these patients. So, how can we diagnose this kind of disease? It's a long-standing disease. The diagnosis can be done with main three modalities. We can go for culture of the various clinical samples, or we can go for the serological diagnosis, and the recently that is the nucleic acid amplification test, which detects the bacterial DNA. Now, among the culture, because this illness is associated with bacteremia, the most prudent sample would be to take a blood culture. Now, over the period of the years, the mode of blood culture has developed from monophasic to automated blood culture system as of today, and the ability to isolate this slow growing organism has got even better. Now, as far as blood culture is concerned, we can find the blood culture can be done in many ways. For example, we can go for the manual method, in which we can use either a monophasic, that is the liquid culture media, or biphasic mode, where we can use both a solid media along with the liquid media. I think you have already seen in your practical demonstrations where we have castaneted bottles in which both solid agar and liquid agar is kept. Now, this is especially helpful because this organism is a very slow growing organism. So, we need to keep the incubation period for a pretty long period of time, almost about a month. So, these biphasic media bottles are much helpful in reducing the contamination. Other than that, we can also use the newer methods like a lysis based blood culture where the cells are lysed, hence releasing the intracellular bacteria, enabling a faster diagnosis, or using blood clot culture. That means we take the blood of the patient, let it coagulate to form the blood clot and culture in an automated system. Now, coming to serology, there are various serological tests. Earlier, Rose Bengal test was very commonly used. Search for serology would include a test, if you see from top to bottom, the third number, that is the standard agglutination test or SAT. This is the recommended method for diagnosis of brucellosis by serology. Other method that can be used is a 2-markup-to-ethanol test which differentiate between the IgM and IgG. Recent methods like Coombs or ELISA can also be used, which are much better in detecting the diagnosis earlier. Over and above the serological diagnosis, nucleic acid amplification test can also be used for detection of the organism much earlier. Among the other things, we have already discussed about blood culture, right? But if you look at the pathogenesis of the disease, this organism actually escapes the immune system by living within the reticuloendothelial cells. The most common area is the bone marrow. So, culture of bone marrow yields a higher sensitivity as compared to blood. However, bone marrow culture is a slightly more tedious and more painful process for the patients. Sometimes, if the bone marrow is aspirated and on biopsy or on staining, we can find intracellular bacteria, that is the gram-negative bacilli within the cells. So, a proper biopsy of the bone marrow may also reveal the diagnosis. Now, coming to treatment, I am not going into the details of the treatment. What you need to understand is this is a chronic disease, hence the treatment should be given for at least about a period of 1 to 1.5 months. That means it is a long standing treatment program. If it is not completed, it is very much prudent that the patient will lapse and have the disease again. Among the antibiotics, the doxycyclines, streptomycins, rifampicins, these are used. Even cotrimoxazole can be used. So, to sum up about brucellosis, what we can sum up is brucellosis is a chronic granulomatous infection, especially of the reticuloendothelial cells. Furthermore, it almost mimics or presents like tuberculosis. The clinical morbidity is high, mortality may not be there, and furthermore, there should be an evidence of contact with animals, either by occupation or otherwise. And especially in today's era of international tourism, you should be aware of the geographical locations where this disease can or may happen, especially in people who are returning from other countries. Now, talking about people returning from other countries, we will discuss about some of the bloodstream infections which are caused by spirochetes. What are spirochetes? These are a different group of bacteria which are spiral in appearance and they can cause many bacterial infections. Now, let us start discussing about the first disease. It is called as Leptospirosis. As the name suggests, the causative organism is Leptospira. Obviously, this is a spirochete and this infection actually happens in nature among the rodents and various animals. Human beings are basically accidental host. Normal circulation of the spirochete occurs from rodents to other mammals, especially to water bodies. Now, human beings can get infected, especially to open wound or cuts in the limbs or skin, and if they are exposed to water bodies containing the spirochetes. This is generally seen with rainfall and flooding. Now, what we know about the most common organism which causes leptospirosis is Leptospirosis interrogans. Obviously, it is a spirochete and is stained by is gram negative in staining. It's an aerobe and is transmitted by contaminated water. This is also an important zoonotic disease, especially even in India. Now, this is a electron microscopic picture of the Leptospira. Now, look at this, how the transmission occurs. From the rodents, commonly the farm animals like cows, pigs or domesticated dogs, they are infected and they end up urinating or defecating in the soil. Now, if this soil is not dry, that is wet, especially during the rainy seasons or flooding, this spirochete survives. And if a human being enters into this water without proper precaution and has a small wound on the skin or abrasion, this spirochete enters into the body and leading to spirochetemia. Incubation period is about 1 to 4 weeks. The presentation of this disease is somewhat, look over here, after the spirochete enters into the body and it starts multiplying, the first phase that we can see is called as the acute septicemic phase. That means this is the period where the spirochete is present in the blood. After that, the body starts to develop, the immune system of the body acts against this spirochete and start clearing the spirochete. And there is an inflammatory manifestation following the septicemic phase. This is called as the immune phase. So, in the first phase, in the first 3 to 7 days, where we have huge number of spirochete in the blood, the manifestation would predominantly be myalgia, headache, abdominal pain and other constituent symptoms. Sometimes, after this phase, when the body starts to act on the organism, we can have manifestations like meningitis, uveitis, rash and fever. This is because of the inflammation which the body, when the body tries to act against the organism. This is generally seen in the first phase. This is called as the leptospirosis. After that, the spirochetes are cleared from the body. Some of the spirochetes escape this clearing and again multiplies and cause another phase of septicemia. Again, we will have, along with the other constitutional symptoms, signs of sepsis. Again, the body starts to act on the immune organism and start clearing, but this time the immune reaction is even stronger. This leads to tissue damage. We can find damage because of the inflammatory process, especially in the kidneys, the liver, etc. And this phase is called as the Weil's disease phase or icterohemorrhagic fever. That means hepatitis with renal manifestation. So, to sum up, this is the picture you can see. In the first phase, that is also called as anicteric leptospirosis. That means anicteric means without jaundice. So, there is no signs of hepatitis. In the first phase, we will have constitutional symptoms where we can find the spirochete in blood, CSF, etc. When the body starts to act on the organism, that is in the immune phase, we won't find the organism in blood or CSF. Rather, the organism may be even found through the urine. And over here, we can find the inflammatory results of the disease. This is called as the phase of the anicteric leptospirosis. Thereafter, the fever or the symptom subsides. Some of the spirochetes again, if it escapes the immune clearance, will again proliferate and cause another phase of leptospidemia. We again, when we can find the organism in blood, CSF, etc. Thereafter, again the immune system will start acting even strongly. Similarly, we cannot find the organism in the blood or CSF, but this time because of the strong immune response, tissue damage is seen, especially if it happens in the liver, we can find hepatitis manifesting with jaundice, hence it is also called as icteric leptospirosis. Or we can find renal failure where the glomerular membrane may be affected, or we can find hemorrhage where vasculitis, because of the vasculitis hemorrhage may be seen, or even myocarditis. Respiratory system or the lungs can also be affected, leading to alveolar damage. So, if we sum up the signs and symptoms that are seen in leptospirosis, we can find flu-like illness with high rise of fever, headache, retro-orbital pain, myalgias, photophobia, sometimes even conjunctival suffusion, that means reddish discoloration of the conjunctiva. This kind of symptoms may also be mistaken for dengue fever and other types of tropical fever. So, the bottom line is, whenever you find a patient who have signs and symptoms like this, you have to keep leptospirosis in your differential diagnosis. Moving on, in the second stage we can also find recurrent fever, uveitis. You can see the uveitis over here with reddish discoloration of the conjunctiva and hyperemia. Meningitis, obviously meningitis will have the Brucellosis or the Carnic sign. In Wills disease, I have already told you, there will be signs of the tissue damage like liver dysfunction, rising bilirubin levels, renal dysfunction, azotemia, fever, hemorrhage, etc. Now, how to diagnose? This is generally diagnosed with the help of serology and detecting the anti-leptospira IgM. The standard test that is recommended is called as the MAT or microscopic agglutination test. Alternatively, ELISA can also be used, and even nucleic acid amplification test can also be used. However, keep in mind, when we are talking about nucleic acid amplification test, it can be done from blood or CSF only in the first week of the illness, that is the septicemic phase. Otherwise, from urine we can also use this test. Okay. Many a times this leptospirosis is generally, many cases of the leptospirosis can be seen especially after or during the rainy season. Many times the diagnosis can be done because a huge number of the patient or the inavailability of the various serological or the molecular tests. Epidemiological diagnosis can done by this criteria called as the modified Fiennes criteria. Now, I am not going to the details of the modified Fiennes criteria. What it basically helps is, whenever there is an outbreak of this tropical fever, we can make a presumptive diagnosis of leptospirosis by using this criteria. If we have the clinical data, along with the clinical data and epidemiological data, which would include recent rainfall or contaminated environment, that is the generalized geographical location of the all patients which are coming over here, and the various laboratory diagnosis including the serology. If all these criteria are seen and if we score them, we can make a presumptive diagnosis of leptospirosis. Okay. So, for treatment, we can use doxycyclines predominantly for the mild cases, and for severe cases we have to give beta-lactam antibiotics like ceftriaxone. Now, this is a very interesting phase because although the beta-lactams are extremely effective in cases of the spirochetes, the leptospira can escape them. Hence, we need to give alternatives like a doxycycline or azithromycin in many cases. Now, continuing with the spirochetes, another fever which was very commonly seen earlier was called as the relapsing fever. Why it is called relapsing fever? Because patient would get the fever, and if it is even untreated, the patient would get better, and after some time the patient would again fall ill, and this cycle would go on and on. Hence, it was called as the relapsing fever. If you go and read the history, especially of the European wars, you can find various mentions of this fever. Now, this relapsing fever can be caused by spirochetes and is transmitted by two modes. One mode is by tick-borne and the other is a louse-borne, that is the lice, the human body lice or the tick. Ticks are small insects which are found in the environment, especially in the shrubs and the bushes, and they normally feed on animals like the dog ticks, which are very common, you can commonly see on dogs and other animals. Now, the tick-borne fever is generally seen in the Americas, Europe and Africas, whereas the louse-borne fever can be seen worldwide. However, with the advent of the antibiotic therapy, the prevalence of louse-borne relapsing fever has decreased. Now, these are the various species of Borrelia, that is the causative organism of relapsing fever. Now, if we look at the various species, most of them are transmitted by ticks, except one called as the Borrelia recurrentis, which is transmitted by louse, that is the human louse. If we look at the clinical signs symptoms of relapsing fever, most commonly you can find that The fever comes with repeated intervals. There are some differences between the louse and the tick-borne uh, uh, relapsing fever. However, if we look over here, the incidence of splenomegaly, hepatomegaly, jaundice, rash, these are more commonly seen with louse-borne relapsing fever as compared to tick-borne relapsing fever. Otherwise, the clinical presentation is more or less similar. And if we are able to find the organism in the blood, we can find the spirochete within the blood itself. As far as the treatment is concerned, like the spirochetes I have already told you, very commonly we can use either the beta-lactam drugs like penicillins or tetracyclines and doxycyclines for treatment. The next spirochete disease is called as Lyme borreliosis. This is also caused by Borrelia. Although this disease is generally not seen in India, but I am discussing this disease because this disease is very commonly seen in North America. And there are many people from India, they go to the North America either for job or for vacation, etc. And sometimes they get infected and they come back and this disease may present. So you should be aware of Lyme borreliosis. Now, like the relapsing fever, borreliosis is also transmitted by ticks, more commonly by the deer ticks. It is caused by the species of Borrelia called Borrelia burgdorferi. The common manifestations of this disease are the skin manifestation, where you can find this coin-shaped reddish erythema on the skin. This is basically the stage 1 of the illness, where we can find the skin lesions called as Erythema Migrans along with flu-like symptoms. Thereafter, if the patient is not treated, the patient enters into the stage 2 of the illness, where we can find the spirochete now disseminates and we can find many organ damage, signs of organ damage like cardiac involvement. If the patient is still not treated, the patient enters into what we call as the third stage of the disease, and it may present differently based on the location. In the American continent, the stage 3 illness is predominantly characterized with intermittent and persistent arthritis, especially of the knees, hips, etc. Whereas in the European one, we can find acrodermatitis chronica atrophica, that is, the skin manifestations are more common. Predominantly, if we see in the early stage, only the skin manifestations along with is seen, but in the stage 2, we can find both musculoskeletal manifestations and neurological manifestations, including meningitis, meningoencephalitis. In the cardiac system, we can find carditis. Almost all organ may be affected, and many a times it may also, this is also a fatal disease. Now, those are the manifestations, but this disease is generally not seen in India. So there lies the question, if a person who has returned from either the Americas or the Europe and starts presenting with these symptoms, how can we diagnose this patient? Well, this spirochete can be cultured on a specific media called as the canis media. However, the mainstay of the diagnosis would include ELISA, that is the serological diagnosis, ELISA, and detection of the antibodies through Western blot methods. As far as the treatment is concerned, like all the spirochetes, the predominant drug is doxycycline or beta-lactam amoxicillin or the penicillin group of drugs. In severe infections, we may have to give intravenous ceftriaxones. So, always if you find a patient having this kind of tropical fever like presentation, take the history of the patient, whether the patient does have any history of travel to the Americas or the Europe recently. And the last part of the discussion, we will discuss about a particular illness called as scrub typhus. Now, what is a scrub? Any idea? What is a scrub? No idea. Okay. Basically, scrub vegetations means the sparse vegetation that are commonly seen in semi-arid areas. Have you seen those semi-arid areas? No? কেউ দেখোনি? দেখেছো? All over the central India, especially in the arid areas, you will find almost desertification, but there are some scrubs growing here and there. So those are called as the scrub vegetations. Now what is interesting is that within those vegetations lies a particular tick, and that transmits the disease. This is caused by an organism called as Orientia susugamushi. It's a strange name, basically a Japanese name. The disease was first named by the Japanese, hence this kind of a name. Now, what kind of organism is this? This organism was previously classified as a rickettsia. Later on, because of the differences, it was reclassified into another genera called as a Orientia. Now, this organism is transmitted by ticks which are present generally in the scrub vegetations. This is the tick which can be seen. Now, I have shown you this picture, give an impression of how small this tick is. If you look at this picture, this is how small the tick is. The tick which actually transmit Orientia is a Leptotrombidium. There are various species. In India, Deliensis is the most common type. Another interesting fact is the ticks can transmit the disease, fine. But the larvae of the ticks, those are called as the chiggers, they can also transmit the disease. Hence, this disease is also called as chiggerosis. And how does the larva get infected? By trans-ovarian infection or transmission. That means, suppose an adult tick which is already infected, it lays eggs. The organism is transmitted from the adult tick through the eggs, and whatever the larvae, the chiggers that come out of those eggs, they are also infected. Hence, if any human being is bitten by either an adult tick or the chiggers, they will also be infected. Okay. Again, like other zoonotic diseases, this infection is commonly seen in the animals and the rodents, and human beings are basically accidental host when they go near to these scrub vegetations. Now, what kind of manifestation that can be seen? Along with the constitutional manifestation, we can find something called as eschar. What is an eschar? Eschar is this kind of a wound with a blackish discoloration. This is the kind of lesion that can be seen at the site where the mite has bitten. Okay. But the problem is that most of the time this mite, it may bite to the open areas like arms and the feet if they are uncovered. But if the person is already wearing, say, long covering like full pants, etc., this mite will get onto the clothes and it may bite in the concealed areas of the body. Now, what are the concealed areas of the body? Any idea? It's the inguinal regions, the armpits. In case of females, it will be the inframammary region, or behind the auricle, along the neckline where the hair region starts. These are the concealed areas. Many a times the mite will bite in these areas, and the patient will also not complain about the bite history. So, as a physician, it is your responsibility to look for the bite marks or this kind of an eschar. For example, in this picture you can see the bite mark is behind the ear. So, hence it is very easy to miss this manifestation. Okay. So, other than the constitutional symptoms, we can find an eschar, lymphadenopathy in the region. For example, if it is bitten behind the ear, the regional lymphadenopathy may be seen. If the armpit, it is bitten on the arms or the legs, we can find lymphadenopathy in the axillary or the inguinal region. And other complications which may include encephalitis like features and pneumonia like features. Okay. So, these are the manifestations. So, regarding the transmission, I think this diagram is pretty much self-explanatory. The transmission occurs among the rodents through these mites, and when the human beings goes either cleaning the vegetations, etc., they get infected. Now, what is the geographical location where this disease persists? This is also called as the Susugamushi triangle. Look at this image. This is the Susugamushi triangle. It ranges from Japan up north, Australia down south till the Indian subcontinent. That means this disease is commonly seen in this geographical location, also called as the Susugamushi triangle. However, some patterns are commonly most seen as of today. Earlier, these scrub vegetation were more seen in the rural areas. So, the disease was very commonly seen in rural area. The urban population was seldomly affected. But in today's world where migration of population is very common, hence it can also be seen in the urban population. Generally, many times you can find the patient having history of constitutional illness and tropical fever as a differential diagnosis, and the patient is put on beta-lactam antibiotics, and even after 48 hours the fever does not subsides. And if we do prescribe the patient doxycycline, suddenly the patient becomes afebrile. So this can also give a retrospective diagnosis. However, the mainstay of the diagnosis would include diagnosis with the help of the serology. That means detection of the IgM antibodies within the first week of illness, or IgG antibodies after the second week of illness. Okay. So anytime you find a patient with the symptoms like tropical fever, always get the patient diagnosed for scrub typhus IgM. Another test was historically important, which is called as the Will-Felix test. Now, why it is important? Because of the presence of heterophile antibodies. What are heterophile antibodies? That means two different organisms may have the antigen which have similar binding capacity with the antibodies produced. So there is some kind of similarity between the antigens of Aurencia and Proteus antigens. Hence, the antibodies present can also be detected with the help of the Proteus antigens. However, this test is not done routinely, because much better tests including the ELISA are very commonly done, and which helps in the diagnosis. Other test can also be done is a direct immunofluorescence test, which is considered as the gold standard serological test for diagnosis of scrub typhus. And not recently, but nowadays nucleic acid amplification can also be used as a test for diagnosis in the acute febrile phase of the illness. Okay. So to sum up, the different febrile illnesses that we have to put in our differentials would include brucellosis caused by Brucella, and it's a zoonotic disease which can be transmitted especially from the cattle population, and the presentation is generally constitutional and may mimic tuberculosis. Among the other diseases would include the spirochetal disease like leptospirosis, which is commonly associated with rainfall and flooding, or relapsing fever, especially in India, commonly associated with Louse-borne. Hence, the people who are generally living in unhygienic conditions in refugee camps, homeless people, they are commonly affected with louse, that is the body louse infection, and they can have this disease called as the relapsing fever. Next is the scrub typhus, as we have already discussed, and among the diseases which you should keep in mind is Lyme borreliosis, which we can find especially in the population which have traveled to either the American continent or the European continent. Okay, that would be it. Any questions? Thank you.